Hey everyone, and welcome. Let's be real, chest tubes can be kinda intimidating when you're just starting out. But don't you worry, you have totally come to the right place. We are gonna break this whole thing down piece by piece, so you can walk onto that clinical floor feeling way more confident. And hey, if you're new here, make sure you hit that subscribe button, because we've got a ton more of these nursing explainers coming your way.
All right, so here's our game plan for today. We're going to cover the what and the why, how to get prepped for success, what to look for in your bedside assessment, how to manage the drainage system, and then wrap it all up with the really critical stuff, complications and documentation. We're just going to build your skills one step at a time.
Okay, first things first, right? We gotta start with the absolute basics. What even is a chest tube? And maybe more importantly, what's the huge problem it's actually fixing for our patient? Getting this down is, well, it's the foundation for everything else we're gonna talk about.
So the key area we're focused on is the intrapleural space. The easiest way to think about it is this tiny potential space between the outside of the lung and the inside of the chest wall. Normally not much is going on in there, but when things like air or fluid get trapped in that space, it starts to squeeze the lung. And a squeezed lung can't fully expand to breathe. So the entire job of a chest tube is just to drain all that unwanted stuff out, giving the lung room to pop back open and do its job.
Okay, so we know what it does. But who actually needs one? What kind of patient are you going to walk in on and see hooked up to one of these systems? What's going on with them?
Well, there are a few big reasons. Number one is probably a pneumothorax. That's a collapsed lung, where air has filled up that pleural space we just talked about. But you'll also see them a lot when a patient has a nasty lung infection that's creating a lot of fluid. And it's super common to see them placed after major heart or lung surgery to help drain away any blood or fluid that collects after the operation.
All right, section 2. We've got the why down, so let's get into the how. And believe me, before you even step foot in that room, success and more importantly, patient safety, it all starts with solid preparation.
And this is huge. Safety first, always. These checks you do beforehand, they are absolutely non-negotiable. This isn't just about ticking boxes to look organized. Nope, this is how we prevent really bad things from happening, like allergic reactions, or heaven forbid, doing something on the wrong patient.
So think of this as your pre-flight checklist. First, dive into that chart. You need to know their allergies, their medical history, what the recent labs look like. Then gather up all your supplies. The last thing you want is to be scrambling for something in the middle of providing care. And finally, the basics that should just be muscle memory by now. Pull the curtain for privacy, wash your hands, and use 2 patient identifiers to confirm you've got the right person, every single time.
Okay, section 3, the bedside assessment. You've done your prep, you've got your gear, and now you're with your patient. So let's talk about what you need to be looking for. And remember, this is all about assessing your person, not just staring at the equipment. All right, this is your quick scan. Start with the big picture. How are they oxygenating? Check that O2 set. What's their respiratory rate? Are they having to work hard to breathe? And please, you gotta ask about pain. Then zero in on the insertion site itself. Is that dressing clean, dry, and stuck on well? Is there any drainage seeping out? And last but not least, you need to use your sense of touch. And what you're feeling for is something called subcutaneous emphysema, or crepitus. It is a really weird feeling. When you gently press the skin around the tube site, it feels kind of like, you know that sound Rice Krispies make in milk? It feels like that, crackling under your fingers. It's an unmistakable feeling. And if you feel it, that means air has leaked into the skin tissue, which is a big deal. You need to assess that and report it. Okay, on to section 4. You've assessed your patient, now it's time to focus on the hardware. You have to think of this drainage system as your patient's lifeline. It's your job to make sure it's working correctly and safely.
So, here's your system integrity check. 4 things, all super important. 1. Trace the tubing from the patient to the box. Look for any kinks or any big droopy loops hanging down. We call those dependent loops, and they can trap fluid and block the system. 2. Check every connection. Make sure they're all tight and securely taped. 3. The drainage unit itself has to be sitting upright. And 4, and this is a big one, the entire unit must stay below the level of the patient's chest, always. This lets gravity do its job and prevents drainage from flowing back in.
Now, of all the different parts on that drainage unit, this next one is arguably the most important. The water-sealed chamber is like having a window that lets you see what's happening inside your patient's chest in real time.
Okay, this is so important to get right. You're looking for one of 2 things here. First is something called tidaling. That's when the water level gently rises and falls as the patient breathes, up on inspiration, down on expiration. Like the tide. Tidaling is good, it's normal, it means the system is working. Now, the other thing you might see is continuous bubbling. Not just a few bubbles, but a constant, steady stream. If you see that, that's an alert. It almost always means there's an air leak somewhere in the system, and you need to play detective and find it.
Okay, quick public service announcement. This is a major safety tip. You might hear about an old-school practice called stripping or milking the tubing to clear clots. Do not do this. I repeat, do not. We now know that this can create a massive, dangerous spike in pressure inside the patient's chest and can even damage their lung tissue. It's an absolute no-go.
And that brings us to our final section, what to do when things go wrong and how to document everything. Honestly, knowing how to spot trouble and communicate it clearly, that's what makes a great nurse. So let's talk red flags. When you see any of the things we're about to mention, this is not a let's wait and see situation. This is a pick up the phone and call the provider right now situation.
We are talking about true medical emergencies. A tension pneumothorax, a sudden gush of bright red blood, a sudden drop in their O2 sats or blood pressure, or a sudden change in their mental status, like they get confused or really sleepy. These are all signs your patient is in serious trouble. Recognizing them early can literally save a life.
And finally, your charting. You know the classic nursing saying, if you didn't document it, it didn't happen. Your note needs to paint a complete picture. So you'll chart your site assessment, what the dressing and skin look like. You'll chart the drainage, the amount, color, and consistency. You'll chart the system status. Did you see tidaling or bubbling? And of course, you'll chart how your patient is responding, their vitals, their O2 sats, their pain level. It tells the whole story.
You know, putting all these pieces together, the why, the prep, the assessment, the management, and the documentation, that's what turns textbook knowledge into real-world competence. This is a skill that truly makes a confident and competent nurse.
So I'll leave you with a final thought to chew on. Knowing what you know now, what's maybe the very first sign you'd look for that could signal a life-threatening tension pneumothorax? Think about it. It's that kind of critical thinking that will make you an amazing nurse.
Hey, if this explainer helped clear things up for you, do us a huge favor and hit that like button, share it with a classmate who might be struggling with this too, and definitely subscribe for more content designed to help you crush it in nursing school. It really helps us out.
And one last thing, if you're getting ready for exams, be sure to check out the links in the description below. We've handpicked some of our absolute favorite NICLEX revision guides to help you study smarter, not harder. Thanks for watching, and